To begin, let's look at what OSA does to the body. In people with OSA, the tongue and soft tissues in the airway relax during sleep. When the tongue and tissue totally obstruct the airway, it prevents fresh air from reaching the lungs, despite efforts to breathe. The oxygen content in the blood goes down. The brain recognizes that there's a problem, and it briefly arouses the body from sleep, just enough to open the airway. It also stimulates the heart to beat faster and the blood vessels to constrict to send blood and oxygen to the vital organs. Regular breathing is restored, but the cycle repeats itself, sometimes up to 100 times a night. It's a dangerous cycle. The individual never receives restful sleep, and the nighttime stress on the cardiovascular system increases the risk for developing cardiovascular disorders over time. Untreated OSA puts people at increased risk for developing high blood pressure, heart disease, heart attack, and stroke.
There are various types of PAP therapies which sleep professionals prescribe for specific reasons. Continuous positive airway pressure, or CPAP, provides one constant level of pressure on inspiration and exhalation. This fixed pressure splints the airway open and prevents the obstruction and apnea from occurring. Another form of therapy is CPAP with C-Flex. C-Flex monitors your individual breathing patterns and lowers the pressure at the beginning of exhalation to make exhaling easier. It then raises the pressure to a set level before the end of exhalation to prevent the obstruction and apnea from occurring. With C-Flex, you can select the level of pressure relief that's most comfortable for you. The lower pressure at the beginning of exhalation provides added comfort. It also helps to reduce leaks around the mask and mouth and the discomfort they can cause. In some cases, your sleep specialist may recommend alternative therapies. Automatic positive airway pressure monitors the upper airway and adjusts the pressure throughout the night on a breath-to-breath basis. With bi-level therapy, two different levels of pressure are used to splint the airway open. Lower pressure is delivered during exhalation, and a higher pressure is delivered during inhalation. Both automatic positive airway pressure therapy and bi-level therapy are available with Flex technology. Personalized pressure relief and fewer leaks will help to increase comfort with these alternative therapies. As an aid for patients who are embarking on the treatment process, we've compiled a summary of helpful tips on how to get the most from PAP therapy. Your healthcare team will check on your progress many times, especially early on. Be sure you know approximately when to expect your follow-up contacts from your lab or home care provider, and be prepared to provide accurate information on your progress. These calls are a good time to discuss any of your questions or concerns. You will also schedule follow-up appointments with your sleep specialist and primary care physician. To get the most out of your office visits, take paper and pen with you and take notes. Be sure that you ask questions about anything that you don't understand. If you worry that you will not be able to capture all of the information, consider having a friend or family member go with you. While you're at home, make note of your sleep habits, PAP therapy use, and any residual symptom you have. For example, are you still sleepy when you wake up? How about later in the day? Do you have increased energy? Is there a particular time or circumstance when you have trouble tolerating your PAP therapy? Your evaluation will help the sleep specialist and home care provider guide you toward improved use. They may also ask you to complete questionnaires. In some cases, you may be asked to provide access to information that specific PAP devices automatically collect on therapy use. This information, as well as your feedback, helps them evaluate how you are using and responding to therapy. Good information about your progress can help your healthcare team develop specific strategies that will benefit you. By becoming an active participant in your treatment team, you will learn how to accept, tolerate, and respond to PAP more quickly, and begin enjoying the full benefits of effective therapy.
John, What are some of the possible roadblocks that people who are new to PAP therapy might encounter?
The three most common roadblocks to regular therapy usage are discomfort, issues related to the bed partner, and travel. Many individuals experience a runny nose with the initiation of PAP therapy, especially if they're not already using humidification. This also typically resolves with time and use as the nose adjusts to the additional airflow. Other individuals experience nasal dryness. Options to address dryness include being sure that you are adequately hydrated and using topical normal saline nasal spray before initiating PAP therapy. Cool passover humidification or heated humidification are used to provide long-term relief. Individuals who experience sinus discomfort should consult with their sleep specialist who can prescribe decongestants, topical anti-inflammatory medications, or heated humidification to help alleviate these problems. Mask selection plays a critical role in overall comfort. People should look for mask styles that suit the way they sleep. Remember that a well-fit mask will be more comfortable. Over-tightening the mask can cause pressure sores and actually create more leaks. Masks are designed to seal against the face with minimal pressure. Not all air leaks need to be fixed. Small intermittent leaks around the mask that are not bothersome can be left alone. Of course, leaks into the eyes and ones that interrupt sleep should be corrected. PAP systems are designed to compensate for leaks. You will still receive your prescribed therapy. Some people experience sore chest muscles because the positive airway pressure expands the chest at night and stretches the chest muscles. Fortunately, that soreness tends to resolve with time and with regular use of the PAP device. New technologies like flex therapy have significantly decreased the number of individuals who complain of difficulty exhaling with positive airway pressure. When C-Flex technology does not address the complaint that is limiting an individual's ability to regularly use therapy, a sleep specialist may order a trial of bilevel therapy. Many new PAP users are apprehensive about their significant other's response to therapy. Clinical research shows that untreated OSA disrupts a bed partner's sleep, causing them to lose an average of 1 hour of sleep per night. Fortunately, the bed partner's sleep time and quality improve with the introduction of therapy. A good way to help significant others develop an appreciation for PAP is to share this and other health-related information about OSA. People with sleep apnea should take their therapeutic equipment with them on every overnight trip. Most people find traveling with PAP fairly simple. Airlines recommend carrying the device onto the plane, and since security agents are trained on PAP devices, there should be no problem. Many PAP models have universal power supplies. Those that do not require a universal power adapter for use abroad. Higher elevations can make untreated apneas and the accompanying drop in oxygen levels more severe. It also affects the pressure output of the PAP devices. Some PAP units automatically adjust for altitude, and some have to be manually changed. Adjusting the equipment for changes in altitude will ensure accurate delivery of the prescribed PAP pressure. By learning to address these common roadblocks to regular therapy, people with OSA are able to get the restorative sleep they need.